time that we started shifting attention to not necessarily away from corrective health care, but balancing it with preventive health care. As we all say and know, it's become a cliche. Prevention is better than cure, but we don't manifest it in our action. That's proven to be very wanting, very costly for Papua New Guinea in all phases, in terms of our life, our longevity, lifespan, and in terms of the health of our country, productivity, achievement, and everything else, leadership, you name it. It's very costly because we have not put words into action, balance especially with health, preventive health, with preventive health. And so this is a necessary conversation that should have happened a long time ago, but I'm happy that it's happening now. And for me, I want to also state from the outset to all our students and Professor everybody here that in my time as Member of Parliament, a political leader of our country, as Professor has mentioned, doing all my best for our capital city, trying to ensure that we put everything in place in the time and privileges that I have to lift our city to become a livable city, a city that can sustain good quality of life, enhance the life of people, add value to it. But one of my passion and what I want to leave behind also as my legacy is to have this shift that our people, both young and old, can take responsibility for our own health. Not to pass it on to the doctors and the clinics and the hospitals and the nurses. They will still be there. They will still be doing their job. But first and foremost, each and every one of us, Papua New Guineans, if we take responsibility for our own health, for our own fitness and wellness, we will be doing great good to ourselves, to our children, to our country, to the future of all the many generations that are yet to come. So this is something that I'm passionate about, as you all can see. Apart from all the infrastructure, physical development in the city, one of the things that I do, and I've been doing since 2014, is walking. Very simple activity. I wake up every morning, go for a walk, and on Sunday I walk with everybody. It's a great event. It's one of those things that I would like to say that makes Port Moresby, or put Port Moresby on a different plane, or make it known to the rest of the world in a different plane other than everything else. Because otherwise, everything is almost monotonous. We are building infrastructure development, building the services in health and education, high-rise and all the food and so on. It's almost monotonous. We go anywhere in the cities in the world, it's almost the same. What would make Port Moresby and hopefully to really stand up? If we take responsibility for our own health and start doing physical activity, be active, then we will be known to the rest of the world in that way, apart from perhaps our culture and all our tradition, all the rainforests. So there must be something that we can contribute to the world. And I believe we can do it in terms of promoting health, fitness, and wellness. So that's something I want to share with us, taking this opportunity. I want to also say from the outset too that what is important for us to understand is that our being is perhaps made up of 4 or 5 beings. When you understand this, then you can get it right. One is the physical. So you've got to look after your physical being in order to stay healthy, fit, and well. Secondly, emotional. Most times, generally speaking, and I'm not expert, Dr. Andrew is an expert. Our people make decision or action emotional. We don't rationalize things. We are moved more by emotion. We get angry quickly, or envy, or jealous, and then we take action. And then we try to work it out. It's too late. We have to pay compensation all the time. Very costly exercise. You need an emotional balance. You need to maintain your emotional health in order to also have a good, healthy life. Right? We agree. Physical, emotional, then you need a mental health. Doctor is the expert on that. So we are no expert, but I'm trying to do it by practice. So try to understand myself, how I can best add value to all our lives as residents of our city, contribute to our country, generation now and for the future. I have to look after myself. So I have to look after myself physically, mentally, emotionally, and then mentally. Many times we don't make right mental decisions. We don't assess things. We are not objective. We don't use our mental facility to the extent that we can go. And we also don't care for our mental health. And if you think of care for only for your physical being and maybe emotional, and don't care for your mental, then it's still, the equation is still wrong. You have to deal with your physical being, emotional being, mental being, and of course your spiritual being. Some can also talk about psychological and so on. That comes down to mental. All the psychological, whatever that we go through, it comes down to mental health. And of course, spiritual. We have to be spiritual. We have to respect ourselves and respect something. Respect God's creation. Appreciate and value it. Appreciate each other. If we don't have this, we still get the equation wrong. So I'm emphasizing this because for me I see health in those 4 or 5 contexts that we must address all of them together. If we address one aspect only, then we still get it wrong. Most times in PNG people are not body conscious. In PNG context, I think we think that big is beautiful. The big money. So you drink a lot of alcohol, eat a lot of food, bigger, biggest. Even when you're supposed to slow down, so your body can, digestive system can rest. When will your body rest, especially the digestive system? So when your digestive system don't rest, then it cannot, digest your food. It cannot break it down. So you bloat and you expand it. And people think it's I'm deep with that. I live Papua New Guinea leader or something. This is a contemporary culture we are promoting. It's not our heritage. It's not our, ancestral practice. In our ancestral practice, our heritage, people were fit and healthy. Physically fit, mentally fit, I think emotionally too. They were fit because they rationalize things, they assess things, they have time to rest. In this day and age, we got another culture. It's completely wrong. So, we got to start off with the departure when we are talking about so our people and our country is still getting it wrong, and that's why this dialogue and discussion is absolutely necessary at this point in time. It's necessary too because now the record speaks for itself. I believe you all have been gone through all the data. I have some of the data to I didn't make a speech, a written speech because Professor said I spent 6 days in Vanuatu. There for 3 years running, been branded. One is our happiest country on the face of the earth. 3 years in a row. If you go there, of course, they are, happiest country. In Portugal, you can walk day and night. Men and women, tourists. Market is open 24/7. You can go to the dance and you can come back and nothing will happen to you. Imagine that. So you can see the people there, they are healthy. They've got healthy minds. They've got healthy attitude. They're emotionally balanced. Imagine in PNG, with all our wealth and everything, we are embraced as a behavior, mindset, attitude. The benefits will be immense. That's what I believe we are failing in PNG. But in PNG, I think the statistics I see from the submission that we have made to the national planning is up at 62%. What we can say, premature death. I think that's the best way to put it. Premature death. Our people dying by non-communicable disease or lifestyle disease, 60%. I think in around 2002 or 2020, it was about 46%. So it's increasing all the time. It's cause of death as a result of lifestyle or non-communicable disease. It's the major #1 cause of death now. And that requires us to pause, really pause and have a look at what we are doing health-wise. Is it working or not? And I want to say also that it's not working. It's not working. We're getting it wrong. So we must have a balance. So for me, as I said, I'm very pleased that this discussion is taking place. And also I want to commend to Professor for this initiative to set up the Wealth and Wellness Center. Thank you, as I said. I want to support this initiative because once we get up and running, then it will start to change the narrative, change the paradigm, shift it. I'm not advocating, and I want to make this clear that I'm not advocating that we give up or reduce our effort on curative healthcare. But we need to balance it. Curative with preventive or primary healthcare. That's what is missing in Papua. So let me just give some statistics apart from what you all have discussed yesterday. I last night tried to write some few points so that I will give some substance to my talk. I don't want to just come and give you all some political talk and go away. So I will start off with the cost. Last year's budget, total national budget to health is 1.7 billion. 661.65 is spent on its capital investment. So that goes to the cost of building all the clinics, health center, hospitals, buying all the equipment and so on, paying for the staffs and so on. 661.65 million. So this is what we are spending, I believe, and I would like to suggest, mainly on curative healthcare. Of course, there's some spending on primary healthcare. I did not, do enough research to balance that out. But I would suspect that it's not much, because there's not a lot of effort. You don't see in a city or in the country a lot of effort going to primary healthcare or preventive healthcare. There's not a lot of effort in the direction. So most of this money, 1.7 billion, is spent on curative healthcare. So, ladies and gentlemen, all our guests, we ask ourselves, how are people living healthy? Are they living longer? What is the evidence before us to say that this spending, we are getting a return? I want to give you all statistics in that respect. On the way here, you all see this permanent place of abode, final hotel where everybody will go for rest. 9 months. I'll just give you all the statistics now. I have not done a comparative statistics, but I recently went to visit, maybe 2 weeks ago, and asked the managers there, how many people are buried every day? And they said about 11 people buried every day. So that's about 300 or 300 and something every month. So you start to do the maths. 300 every month at 9 months. Everybody else who are, being buried elsewhere, being carted off to be buried in the ancestral realm. Then if you add it on, maybe there's probably 2 times the number. In Port Moresby now, maybe we have 600 people dying every month. And so in Port Moresby too, death is not something unusual anymore. We've accepted it as normal. And I want to share with you all, especially on our young people, students. When I was growing up, death was rare. And when somebody died, like in my village, my parents, they would go, one month of us crying, and we go hungry. Because we can afford it that time, because it's rare. And when death happens, it's like a special occasion where people grieve. Now, nobody grieves about death. It's just normal. We've normalized death. And it goes everywhere else. And we don't take life anymore seriously. When some people are being killed by violent criminal action, we just wave it away as something normal. We've normalized this type of bad behavior because we get used to, we have numb ourselves to death. We've normalized it. We've given permission for death to occur at any time, whatever way. Non-communicable disease or killing or whatever, tribal conflict or political conflict. It's a big problem in our country. We are not valuing life to the extent that it should, where in our faith we, appreciate life as being a gift from God. Or in our constitution says the primary responsibility of a government of state is to protect life and property. All the laws and function of the state is to protect life and property. One life lost unnecessarily should compel us to take action. But because we have normalized or numb ourselves to death, we are giving permission to death to occur anywhere, any how, including non-communicable disease. Even though now it's 62%. Nobody is jumping up in parliament to say that, we must take action. Big problem we are having in the country. So, in terms of statistics, it's very damning. Not long, but then probably our manager started giving me about 6 months. Governor, maybe 6 months. After that, you have to decide where we are going to be buried, your loved ones are going to be buried. No one ground must be more. No one ground. I'm telling you all, there's no land to build, to have more cemeteries. I'm thinking maybe we'll have a high rise or something, just put them in tombs, like local. Then it will fill up very quickly and it costly exercise. So I'm suggesting people go to cremation. But everybody thinks that that's evil something or satanic something. And I'm still trying to convince everyone. But these are the consequences of us. Of course, everybody will die. But I believe one of our most sacred task and responsibility is to extend our life, to live as long as in our faith God wishes us to do, or in our own, hope to live as long as we can live, to see all our grandchildren, to see the outcome of our work and all that to have a legacy. So this comes back to, our, what I would say, life expectancy in PNG. This life expectancy in PNG at this time it stands at 65.35. Some of our medical people might have a different sort of
life expectancy
rate, but this is what I have been able to come up with. I've done did a bit of research from MRI, PhD MRI, medical research institute's write-up, 65.35. And I want to compare, give you a comparison. Fiji is 68.5 years life expectancy. Samoa, and I want to mention Samoa. Samoa is a country of 200,000. Must be it's like China to Samoa. We are probably over 1 million already. Only 200,000 people. Their life expectancy is 72.77 years. I'll give you a comparison in GDP. GDP for PNG in 2023 is recorded at $43 billion US dollars. Fiji recorded at 5.49 billion. 5.49. 43 and 5.49. And Samoa is 2.55. You'll do the maths and work it out. And you'll try to have a look at what is happening in Paris. We have only 7 athletes. You know, they are going to perform in maybe 5 games. Small Samoa probably got about 30 plus athletes participating in 9 games. Fiji too probably got 42 athletes participating in about 7 or 8 games. You all do the maths and do the comparison. It's not a good record for PNG. It's very damning on PNG. They've got low GDP, but they've got high life expectancy. Let's should compare all of us if nothing else is comparing all of us. I want to complete this, my discussion and share with you. I've got a number of statistics to share with you all too, but I just skip this with Dr. Planty. So I just want to, and in my personal goal to look after my health and fitness and wellness and try to see how what is happening in other parts of the world and what I can follow, what I hope PNB can also subscribe to. I come across this, places in the world that there's a centenarian lives, where centenarian they thrive. So there's some parts of the world that people live over 100. It's good to have a look at how they manage to live up to 100. Why can't Papua New Guineans live up to 100? When we are dying at 65, you work it this way, all our students. By the time you graduate, you're probably 24. And then when you go out to work, you start to get some experience in your profession and work and life experience. By the time you've got that experience and you want to deliver, you are ready to start to deliver. You are probably maybe 40-something. And by the time you are ready to start delivering, you are old already in PNG context. When you are 50, you are old already. And when you are 65, Makului die now. So when are you going to, what is PNG going to, educate, give skills and experience, and then you are at a time in your life where you'll start delivering, thinking about yourself, your old age, and your children, and the many generations to go. We don't have the time because we are not living that long. In our prime, we are dying because of non-communicable disease, bad lifestyle, fat is good, or being inactive is good. It's very costly for our nation in so many ways. All our young professionals, we train them, spend all the money, scholarships and so on, and by the time in their prime, they're gone. There are more consequences after that too, because as you all know, our people remain superstitious. So when young men die, young women die, hey, it's a Maria Lavia and Puri Maria, someone kill him. It's a new phenomenon that's happening. It has not happened before. I know. I was born in the 60s, and I know this practice. It's not our culture, not our heritage. It's something that just came up now. Some young men trying to become some landlord, a warlord or something, big man or place. They're starting, this practice of blaming not so much men but women. Another thing, we are blaming women all the time. They have gone off topic a bit, but I wanted to talk about September. Normally in the USA, you all should be aware of this SDA community. They live beyond 100 because they build churches, hospitals, they stay physically active. And then we have Okinawa in Japan, Sardinia in Italy, Nicoya Peninsula in Costa Rica, Icarica in Greece, and of course, Loma Linda in California, USA. What is their secret? I'll give you basics that I read from, I tried to do a search on them on Google. This is what I am able to summarize from all the narratives, comparison between these 5 regions of the world that people live beyond 100. One, they do moderate and regular physical activity. We don't have to do trying to be like what's his name, Usain Bolt, go and run 9 seconds, 100 meters Olympics. You can just do moderate but regular physical activity. They have a purpose in life. Their purpose in life, they're very clear. And many of us probably have this problem. What is my purpose in life? And how I try to address it is that I address it that how I can be useful to myself and my community, to my country, or to our people, my tribe and clan. And then you find your purpose in life. If you keep on searching, and why God gave me this privilege to be alive, you might not find the answer. The main thing is to find out how you can be useful and purposeful. Stress, they have a stress reduction method. They moderate. I'm reading it on my phone, so I better get my phone here because my eyes is going as well, so I need to work on it. Moderate caloric intake, low intake. They try to reduce it. Plant-based diet. That's another thing that PNG we are not really conscious about it. We try to eat pigs and meat and all this. What's the rationale like? I try to ask all these people eating meat, for example, the cow, they eat grass to make meat. So why are you eating secondary meat to make meat? I don't know, some doctors, maybe Dr. Ami or some of the doctors here, Dr. Larry can tell us, Professor, why we need to eat secondary meat to make meat? The cow, they don't eat meat, they eat grass. So I don't know the logic. Maybe we are made of our DNA or something special. I don't get it. Moderate alcohol intake. Of course, some of this community, they drink some wines, but it's very moderate. And they engage in spirituality, or a religion. They engage in family life, and they engage in social life. These are very basic. It's not rocket science. Ladies and gentlemen, it's not rocket science. We can do it. So we need to start the conversation. And I'm very pleased that the university here, Pacific Adventist University, you are starting this conversation. Let's keep on having this conversation and dialogue. Dr. Ambi is here now. She'll come and speak. Dr. Ambi has been carrying this load on herself, and she's becoming she's becoming possessed. But she's not getting a lot of support, so I'm happy that she's here now. Dr. Ambi, you need to, I want to suggest that you need to have stakeholders and partners. So I'm always here, but you only use me to partner you on your beautiful mind TV program. You never offer. It's your fault. Professor is here, and PAU is here, and the SDH. I work closely with them because one of their main talent is for health and education. Apart from spirituality, spreading the gospel, the word of God, they focus on health and education. They are a very good partner to work with. Professor has advised me about their plans from the Wellness Center. They are also planning a level 4 hospital here. So Professor and our team here, I've also briefed the member for Kaidoku here, because if this facility comes, or the Korean people, they are SDA people, and they are just next door, and they'll come and use the facility. So you need to put your DSIP in the level 4 hospital here. So we'll have a conversation with you. But thank you very much, everyone. I'm very pleased that you all are doing this, symposium. As I said, I want to contribute in my time that using the platform that I have to amplify this message. I have the privilege and opportunity to be member of parliament. Now I am fourth term, so people will listen to me more. They will take me seriously. But as you all know, in the last 10 years, we have been doing active city. We've spent time, effort, and resources into it. You won't get the result immediately. A lot of our people, they get into health, fitness, and unwellness. It takes a long time. So just because you go and do a bit of walking and here and there, doesn't mean that you will change over time. You have to invest in it. And for me, I'm investing in it now because when I'm old, I don't see my children or grandchildren, they're coming to help me. I'm telling you all now, like our ancestors or parents or grandparents' time. They're busy with their life, they'll fly off, they go and marry somewhere in Los Angeles or somewhere. But why are you sleeping on you here? So part of my personal goal too is that when I'm old or retired or end the political life, and I'm living on my own, I can at least go to the shower, go to the toilet, go swimming, without much help, because in PNG we don't have old people's health care. There's no aged care for elderly and retirees and so on. So we are on our own. Me, I'm working on the basis that I'm on my own. And I operate on the basis that anytime God can take my life away, because there's one mystery of life that we all never know. Who you're going to marry and when you will go. So every day I try to live life. Maybe I might go today, so I'll maximize the time and privilege in life, in parliament, wherever I have to extend my life. Maybe God will allow me to live longer and I can have a lot more impact on ourselves in the city and our country and our people. Thank you so much.